Today's surprising science. 70% of people diagnosed with irritable bowel syndrome don't actually have IBS. Years of pain, bloating, bathroom emergencies were actually due to hidden food allergies that standard tests completely missed. How is this possible? Today we'll go through this new research and just how it could be missed in so many people. Look into some clues of how to know if you might be in that 70% who could find dramatic relief when you know your triggers, what the most common triggers are, and what you could do about it. When I first started recognizing that hidden allergies may be behind a lot more problems than we think, my estimates of how many people might be affected were still pretty modest. This changed drastically when I looked into IBS. IBS affects 15% of the Western population and is increasing worldwide. This translates to nearly 1 billion people on Earth suffering from recurring abdominal pain, bloating, constipation, and/or diarrhea. And an estimated 70% of them, which is still hundreds of millions of people, could be cured if they could all find their own triggers. The thing to know about IBS is it's a diagnosis of exclusion, meaning it's a label slapped on when no other cause can be found for the symptoms. In fact, much of what I say in this video likely applies to all functional gastrointestinal disorders where no structural abnormality has been found. And why isn't allergy considered a cause? This is the frustrating part. You probably did get tested, but skin prick tests, blood tests, they were all negative. So your doctor concludes, no allergies, and that's that. Well, we now know there are many ways you can still have real immune reactions going on even when tests are negative, as I went through in my last video. And the hundreds of millions suffering just from IBS is one real-world implication of that. So what changed? What did scientists discover? In 2004, it was first reported that IBS patients had increased numbers of mast cells in their rectum. Since then, multiple studies have found that mast cells and mast cell products such as tryptase, histamine, and prostaglandins were increased in the intestines of those with IBS. With new microscope camera technology called confocal laser endomicroscopy, scientists were able to see the intestinal lining on a cellular level in real time. Most people with IBS will have normal-looking mucosa or at most some vague chronic inflammation with an endoscopy, but when you can see the cells, it's a different story. They could see an increase in eosinophils and mast cells along with gaps forming and the barrier leaking. And this happened in 2/3 of IBS patients when tested with just 4 foods, which means there could have been others who were missed if they react to other foods, and over 50% showed immediate intestinal barrier disruption. Other studies showed that 70% improved markedly on hypoallergenic diets. Despite all this evidence of immune reactions happening in the intestines, the patients did not test positive to IgE blood tests. That's how they're hidden. For IBS, there are 2 major reasons why tests miss these allergies. First, they are non-IgE mediated allergies, so there are no IgE antibodies that can be detected on standard allergy tests, but it still causes real inflammation and symptoms via other immune pathways. The increased presence of eosinophils and mast cells point to this. Second, local IgE reactions. The antibody produced only in the intestines and doesn't enter the bloodstream in detectable amounts, so the allergy exclusively lives in your intestines. So from multiple studies, it seems a fair guess that if you have IBS, there's a 70% chance you are actually suffering from atypical food allergies. But what about the 30% who don't respond? And are there any clues to know which camp you might fall into? The 30% who did not improve on elimination diets had severe intestinal infections in the past that likely damaged the intestinal nervous system. They have actual motility problems, not allergies, so they're not helped by diet changes. They need different treatment. Clues that you may be in the 70% that have a typical food allergy? Do you have any personal or family history of allergies? Environmental allergies to pollen, dust mites, or mold were common, as well as a childhood history of eczema. Have you ever suspected or noticed changes in symptoms after eating certain foods? Do you have symptoms beyond the gut, such as fatigue, headaches, and joint pain? If this sounds like you, make sure you rule out other causes with your doctor, and get allergy testing if you can, if you haven't already. Start tracking what you eat and your symptoms, and consider an elimination diet. The big four triggers for IBS that 70% of patients reacted to at least one of were wheat, milk, soy, and yeast. And that's a good place to start. Just remember, those aren't the only possibilities. 30% of patients reacted to other foods. Quick note on the low FODMAP diet. You may have heard of it or even tried it. If it helped, it might actually be because you accidentally avoided your trigger foods. Like milk and wheat are the big two of hidden allergy triggers for IBS after all. FODMAPs are likely a minor player compared to atypical allergies and may make you avoid more than is necessary. That's why finding your specific triggers can be a lot more effective and less restrictive long term. Now you might be wondering, I've eaten wheat my whole life. Why would it suddenly be a problem? Our gut can change over time due to stress, infections, antibiotics, or even aging. We can lose tolerance to foods we once handled fine. And in fact, you may have no idea you react to certain foods until you actually try eliminating them, which was exactly my experience. When you choose your suspects, think, what do I eat daily? Any foods I've suspected in the past? What foods do I find especially addictive? Eliminate your suspects for 5 days and see if your symptoms improve. Then reintroduce one food at a time, carefully. Start with a tiny amount and gradually eat up to a full serving over a few hours as tolerated. If you react, which may be anywhere from hours to 2 days, remove it and wait at least 2 days until symptoms clear before testing the next food. I know. If you're familiar with elimination diets, you may be thinking, hold up, 5 days? Since common recommendations range anywhere from 2 to 6 weeks. I did a double take too. But here's why it's different for IBS. Reactions are quite immediate once the food touches the intestines. For more delayed type reactions like an autoimmune disease, yes, you might need up to 6 weeks. But for IBS specifically, most people can start finding their answers in 5 days, which makes things a whole lot easier. And if there's anything ambiguous about the results, you can then commit to a longer time frame to make sure. For what it's worth, all my troubles were found with the 2-week elimination diet. Let me know if you'd like a more detailed video on elimination diet how-tos. This isn't just about IBS. Similar studies have been done on functional dyspepsia, which present with symptoms of early satiety, pain, heartburn, and a sense of fullness or bloating, and found similar hidden allergies were behind these too. It's likely the case for chronic reflux and pretty much all other functional GI disorders. These used to be considered psychosomatic or all in your head. You may have been told, oh, it's the stress, it's just IBS. Stress, of course, can make everything worse, but you weren't imagining it. Something real was happening in your body, and this is for 100% of IBS sufferers, whether the 70% that have real immune cell wars going on, or the 30% who have motility problems due to nerve damage. And we are learning a lot more on this now. In fact, scientists want to rename these disorders of gut-brain interactions. Anxiety and depression frequently coexist with these disorders, but they aren't the sole cause of the symptoms. It goes both ways. And if the cause is atypical food allergies, it's likely to greatly alleviate mental symptoms too. Both stem from aberrant immune system activation. It's a two birds with one stone situation where the reward is a dramatic improvement in quality of life, both physically and mentally. We're talking no more pain or bathroom emergencies, being able to enjoy life outside your home, from brain fog and fatigue to mental clarity and energy. Do you have IBS? Have you tried elimination diets? What has helped you the most so far? Share your story. It might help others find their answers too. Thanks for watching. Till next time.